Treatment without fear of pain is possible. Let's start out by saying that usually the fear we see from folks that come in is the fear of what it's going to cost. So we go ahead and we do your treatment plan, and we sit down with you and let you know what that's going to be and work all that out. And usually folks are very, very pleased and feel like they are getting that good value for the dollars that they're spending on their dental care. Fear of the procedures themselves, extractions and so forth. Going back in time, the reputation of dentistry hasn't been great. Pain is always, and fear have always been associated with getting tooth extractions and dental work done. And that started way back when they didn't have any anesthesia. The anesthesia wasn't that great. The needles they used to give the anesthesia were huge and they hurt. So, you know, we had a lot to overcome there. The instruments, the medicines that we use, the anesthetics we use, the sedatives we use, all combined to make this possible without you having a lot of pain. I alluded to this in our segment on immediate dentures. What we do to eliminate this pain is that we give you a regimen of medications that you take before you come in. When we're doing all your teeth, you do it the night before. The night before, you would take a sedative to help you sleep good. Then the next morning, early in the morning, you would take a dose of a corticosteroid, and what that does is an anti-inflammatory, and it makes your immune system stop that response to an injury, which is taking a tooth out or doing surgery on you. So we stop that inflammation, which causes pain. Subsequently, the following morning, you would take another dose of that medicine, and the 2 mornings after. So you get through that first few days without a lot of swelling and pain, and that's a big deal. We stop it before it starts. Now, if you're frightened when you come in, relax. The morning that you come in for your appointment for your surgery, we're also going to give you a sedative that morning. You'll take it before you ever come in. Usually when folks come in, they're nice and relaxed. They just kind of feel like they ain't got no bones. So they just kind of relax and they're smiling a lot. And we get them back and we get them started with their surgery and make sure they're good and relaxed. I've said this before, if we have somebody that snores, usually within a minute or so after we start working, they're going to go to sleep and start snoring. They're not going to be unconscious. I can touch them and say, wake up, and they're going to wake up. They're just kind of snoozing. They're kind of in and out. So that makes the whole process a lot easier. So when I have somebody that's sitting there at home like you are now, watching this on the website, and you're saying, oh gosh, this is going to hurt, it's going to be terrible, kind of take it easy on that. We can talk to you when you come in and kind of show you exactly what we're going to do and go into great detail just to make you comfortable, because before you ever show up for that appointment, we want to have you good and comfortable about doing that. And the way we do that is make sure you know everything that's going to happen in detail. You'll be given your medication regimens before you leave from your consultation appointment. And then when you come in for your visit, it's going to be a good surprise for you. It's not going to be as bad as you think. So if that's been a big barrier for you, don't let it be anymore. Don't let fear or pain stop you from moving forward to get the treatment you need. Those are things that can be overcome and barriers that can be removed, and we'll help you do that at Augusta Dental Center.